Okay, well, hello to all my TLC Health Freedom Tribe. Sean gave us that name, and most of you sent me a message that you like that name, TLC Health Freedom Tribe. So, hello to all of you. And if you can hear me, if the sound is good, just give me a sign, someone, by saying with the thumbs up or something. Today is Monday, December 6, 2021, and we are Tustin Longevity Center. I'm Dr. Ella Thorpe, the founder, and we've been here over 20 years, and we've been practicing, and I've been practicing 40 years. The other doctors that we have are also very capable and experienced. Thank you for that, Carol. Thank you for letting me know. In integrative functional medicine, so that we're looking to blend the best of allopathic standard medical care with alternative complementary functional medicine to give our patients the greatest outcome. And we're so grateful to God because we have had such healthy patients throughout the past 2 years now since COVID, and no one has died. No one had to be hospitalized, to my knowledge, even still. So we can truly say that preventative medicine and helping to educate our patient base to the best ability for helping them stay well is the right way to go for preventing all disease, all illnesses, and restoring health and giving you a more optimal life. So that is our focus here. We take questions, and on these questions, we don't want this to be understood as personal, individual advice. If you're a patient, I won't speak to you individually. If you have a question, call the office in the morning and get that question directed to me personally. Friends and family who are not patients can join with us. You can like and please subscribe and share this with family and friends. And hopefully this will be a means or a way to help everyone to feel part of the TLC Health Freedom Tribe and to support you in that. So let's see. Oh, Robert Pinsky is starting, and he says, I have a joke. I was just going to apologize that I didn't even think I rushed in from all the stuff that I'm doing. Okay, let's see. What did he say? I have a joke and a follow-on question. Okay, a pool man came to service a pool that was completely green. He saw the owner pouring psyllium seed into the pool. He asked him, what are you doing? The owner said, I'm trying to fibromyalgia. I'm trying to fibromyalgia. I don't understand. Fibromyalgia. Oh, algae, fibromyalgia. Okay, I see. Okay, thank you, Robert. That's cute. Okay, so his question, Robert has a question, and he says, what is fibromyalgia? What is it caused by, and what are the symptoms, and how does conventional medicine treat, and who do you treat, or how do you treat it at TLC? Fibromyalgia is a name of a symptom complex. It's not a diagnosis or of a identified disease. It is a name for a symptom complex. So fibromyalgia is often managed by rheumatologists. If you have tenderness to your muscles and you have the points that they test, and if you're complaining of pain, chronic pain, which then is associated with chronic fatigue, and there are various other complaints like neuropathies or tinnitus or headache or anxiety associated with it. But it's a sense of being overly sensitive throughout your body. Fibro, meaning the fibrous component of your composition, and myalgia is muscle chronic pain. Now, what can cause this? For instance, when you first come down with a cold, a flu syndrome, you complain of very similar symptoms as fibromyalgia. For instance, you ache everywhere, you're sore everywhere, anywhere you touch, your muscles are sore. And this then would imply that fibromyalgia has some type of a cell cytokine inflammatory activity going on. Is it triggered by an infectious? Is it triggered by a toxin? Is it triggered by hypoxia? Meaning you could have tiny, tiny, tiny microclots over your body. And if you have a capillary tree where the blood vessels go all over, but at the very distal ends, there's microclotting, you're going to ache all over. So how do doctors treat it? They really don't think much about their training, or maybe they don't get it these days. But in chemistry, you have to understand redox, which is the mitochondria, which is the electron transport chain that makes adenosine triphosphate. You have to understand the enzymes and coenzymes that are very much involved in this. And when you understand that, you realize that the influence of glyphosate, genetic modified gut damaging, hurting the tubing of your gastrointestinal system, being marketed to eat bad foods, high in sugar that creates stickiness and promotes clotting and inflammation, being marketed to drink fun drinks instead of water. You're being marketed to and learning to just work in a seated position all the time. You're not as active. Then maybe a common cold virus or toxin can be more amplified if you're eating a higher processed diet full of sugar, not drinking enough water, you're less active, and you're getting genetic modified foods in you. You're aging and your enzymes are declining. All these things add up to myalgias, muscle ache, pain, and fatigue. So they don't know what it's caused. We believe we do know what causes it. And this is what we teach our patients. We point out to them that you better be drinking a whole lot of water, half your weight in ounces every day. So if you're a 200-pound man, 100 ounces a day. And if you're getting older, you need enzymes. And maybe even young people who are with blood type A, because blood type A is a type of blood that puts you at risk for maldigestion, which creates a chronic inflammation, which is associated with a lower enzyme production. And then use EDTA chelation to improve microcirculation. High-dose vitamin C, if there is a chronic low-grade viral activity, that can act as an antiviral treatment with high-dose vitamin C, and so forth. So that's how we do it with enzymes. We use high doses of enzymes, maybe 5 or 8 Vitalzyme, Vascuzyme, or Proteozyme. These are systemic enzymes you take on an empty stomach, morning and evening. Some people use it even 3 times a day, and they will feel better. Sometimes we give them natural hormones to help repair and stimulate healing. Fasting. I just did another 2-day fast just for the fun of it. I just Saturday I ate dinner, and I woke up. I was so busy all Sunday, and I just didn't eat. I got to the dinner time, and it would have been 24 hours. So I thought, why don't I wait till Monday night? So I just did a 2-day fast and ate just before I came here. So fasting helps heal this. So that's a long way around, Robert, to try and give you the diagnosis of a fibromyalgia symptom complex, which is really oxidative stress at the mitochondria. The other thing you have to remember is we're made of fat and protein, and we're always talking about this cell membrane here, because you boil down, you actually come down to cells, and those cells have a membrane, and that's made of fat and protein. So phospholipids, linoleic, alpha-linolenic acid. We use the The doctor's bar, part of that, we created those doctor's bars so that you would get a high dose of phospholipids, and then it would be low carb. So we tested that, and hopefully that kind of answers your question. Okay. Debbie S. says, hi, Dr. Rita. Hi, Debbie. On the occasions that you must eat at a restaurant, is there anything you can take afterwards to detox from the hormones, GMO-fed, farm-raised fish, bad oils, and etc., systemic enzymes? Well, here's my answer. There are some things that will help you, but this is how I approach going to a restaurant. We're interviewing some new doctors. We're looking to hire some new doctors. And we had to go out to eat afterwards before they flew back home. And I ordered a steak. And then I ordered just a salad. So I didn't get rice or potatoes or anything added. I just ordered my steak and a little green salad. And this is what I do when I go out to eat. Any sit-down restaurant, you pretty much have a good degree of control. I try not to open the menus. So when the waitress comes, I just try and not tempt myself by looking at the menu, and I'll tell the waitress, please just grill me up some chicken or some salmon or a pork chop or a steak, and then give me a broccoli or Brussels sprouts. I think I had Brussels sprouts. I don't know if I had Brussels sprouts. But anyway, so it's a vegetable, Brussels sprouts, broccoli, asparagus, green beans, spinach, that kind of stuff. And then I'm not worried. Now I can see what other people eat, but this is how I approach whenever I rarely go out to eat. So that way they can't do much to it. They can't jazz it up too much. I don't ask them for cheeses on my broccoli or glazes and stuff. I just kind of leave it like that. So that's how I do it. Now, if you took some, I always take my digestive enzyme that's sitting right here at my desk, orthodigestzyme, because at almost 70, I don't have the digestive capacity I had in my youth. So yes, that will help. Systemic enzymes will help. Drinking a lot of water or fasting for 24 hours after a meal like that. So Christmas, so I fasted 2 days, then we're going to have our Christmas party for our employees this Friday night. So I'll guarantee you I'm not eating over the weekend. So that'll be another 2 days. And then we'll have Christmas dinner. I probably won't eat anything on the 26th, and then we'll have New Year's. And New Year's, I always do my 5-day fast. So that's how I would approach it, Debbie. Debbie goes on to say, if someone has a good amount of heavy metals in them, does that cause vitamins, nutrients not to be absorbed? No, it doesn't. We give, as a matter of training, I've been around training, and I teach chelation therapy to doctors twice a year formally with the American College for the Advancement of Medicine. And by rote, over the many decades, they have always recommended that you take a multivitamin mineral. I have never seen mineral depletion from chelation therapy removing heavy metals. I've never seen it, because I know not all my patients take my multivitamin as I've advised them to do. And I haven't really ever seen any mineral deficiency emerge. If you're eating steak and pork and chicken with the skin on it, and salmon, and I like anchovies, I like sardines. If you're eating these things, you're going to get a rich amount of minerals and stuff. So even if you have heavy metals at a higher amount, that is not going to cause vitamin nutrients not to be absorbed. Rather, as you pull those toxins out, you're going to have ready available healthy cofactors to revamp the actual machinery, you might say, of your engines to your cells. So that's what I would say there. SM says, I have tried taking methylated vitamin B in tablet form with food, but it makes me nauseous. Tried it spray form, but it still made me nauseous. Any suggestions? Maybe take less. We have a methylated form here. One is the one that I created, TLC methyl B complex, and it comes as a capsule that's powdered. And the dose is 4 capsules a day, and that gives you a very good dosing. And you need this because they're water soluble, and you rinse it out of your body every day. So if you took that 1 capsule, start with 1 capsule, open it up, and I would open it up into something like unsweetened applesauce, and mix it in a couple tablespoons, and try that, and have your meal. Then if you tolerate that, then you can go to 2 capsules a day. Then have your doctor test your B vitamins and see, because methylated forms are very potent. And you may not need the high dose that I have in TLC methyl B complex. We also have Orthomolecular's methyl B complex, and they're very good as well. They're in capsules, and you can do the same thing. You can open it, and you can open and pour out just a little bit of it as you wish. So that's why I like the capsule forms. There's another form called ATP Ignite. This is a drink where you open up a little sachet, a little wrapped up package that has powdered vitamins B in it, and you put it in some water, and you can drink it, and you can sip it to your tolerance. So I think that might be a help to you, SM. And use the capsule form, and use smaller amounts and work with it. You do need it. Let's see. Elizabeth says, hi, Dr. Ellithorpe. Hi, back to you, Elizabeth. What is the best time to take my methyl vitamin B and CoQ10? I would say in the morning, because that is part of your energy for the day. Now, I split mine in the morning and the evening. I take that TLC methyl B complex that I made. It's high potency. I take 2 in the morning, and it's on an empty stomach, by the way. I'm B positive blood, and we typically have a very slow metabolism, and we're very tolerant, food tolerant. So, but anyway, I take 2 in the morning, and then I take 2 at night, because at night, that's when you want to repair. And there are so many biochemical reactions for repair, protein synthesis, and so forth. B vitamins are just very, very valuable all the time. So, but if I only had one time to take it, I would take it in the morning. That's for sure. CoQ10. Coenzyme Q10, really the research in general speaks to the fact that dosing is the most important thing, not the time that you take it, with food or without food. So they find that you have to take around 300 milligrams of coenzyme Q10 to see it have a physiological measurable effect on your energy, your mitochondrial performance of energy, ATP, and so forth. We have done research. We're published in phospholipid. Remember, the lining of the cell is a double chain of these lipids called phospholipids, and that goes around your cell, but it also goes around the mitochondria. And the mitochondria has these cristae, we call them, these invaginations, like a kidney bean, and it's the same phospholipids. So we have worked with other researchers, and we mix in phospholipids that you would get from egg yolks or meat or fish or chicken or beef, pork, and things like that. These phospholipids seem to augment the absorption of coenzyme Q10. And coenzyme Q10 is not really referred to be a fat-soluble vitamin. Like vitamin D is fat-soluble, vitamin A is fat-soluble, vitamin E is fat-soluble. And so we feel that our research has mixed in these fats, phospholipids, with the CoQ10, and we have seen improved parameters on the lab indicators of health. So that might be something to think about, taking it with a phospholipid, or take it with, phospholipids that are in our bar, or we have the NT powder, which is phospholipid, or eat it with an egg, or eat it with a steak. What do? I take it first thing in the morning on an empty stomach, and mine is a 300 milligram capsule. And so I would just say, you can't drive your life with, such minutia that you have to worry about every vitamin and when you're taking it. You're going to get benefit anyway. So I have 2 times in the day where I have some semblance of control. That's at 5:30 till about 7:30 in the morning, to get everything I need to get done every day of my life. And then around 7:30 to 8:30 at night, before I'm getting ready to go to bed. And so if it's going to work, that's how it's going to work in my life. And that's the best I can do. Let's see. The next question is also by Elizabeth. I take the TLC brand of vitamin B. Okay, so you're on the TLC methyl B complex, which is a very, very potent form. And again, I would take it in the morning if you're going to take it at all. And I take it at night just to kind of, I take quite a few supplements. So, I can, split it in half roughly. So I take 2 of the B complex in the morning, 2 in the evening, and I sleep like a baby. So hopefully I repair, and my healing and longevity will continue to serve me well. Dolphin says, thank you for being a great doctor. Well, bless your heart, Dolphin. What can I do about bruising and bleeding since starting Tamoxifen 4 years ago? Well, estradiol is what helps the skin be thicker and smoother, and the backs of your hands. But eating sufficient protein, getting those phospholipids, and drinking enough water, and exercising, and doing some fasting. Fasting stimulates natural, God designed genetically for us to have growth, repair. And in the fasted state, that stimulates repair. So notice how I'll do a day or 2 fasting every week. It's just how my busy life goes. So fasting for about 36 hours is when you start to see growth hormone. It really peaks, starts really emerging at 48 hours and peaks around 36 hours. 48 plus 12 is 50, 60. What is 24 and 24 is 48, and 58 and 2 is 60 at 60 hours. Okay, so that's probably the peak you're going to see. So people who do a 2.5 day fast are really building up their growth repair hormones. Dr. Meineke made the amino acid product called Perfect Aminos, and we carry those here. It's in a powdered form and it's in a tablet form. I like the powdered to decrease the amount of pills I take. And he is really retaining, I think he's about 80 now, and he's got all these awards for all his triathlons, and many, many people have used his concoction of the amino acids that make up the proteins are very important. Parent essential oils, Dr. David Peskin, Peskin, that's the alpha-linoleic and linoleic acid. We have it in the liquid form. That's in that little, you can see on my wall, this is the bottle right here of the capsule. And then above it is the liquid form there. And I'll take a drop if I feel dry, I'll rub it on there. But I rub my estrogen on the back of my hands. And I think that's probably, Dolphin, the best thing you can do for all things for longevity, because the more you keep your blood sugar, carbs low, the lower your insulin hormone will be, the less fat you'll have, and the growth stimulation of insulin makes tumors to regrow. So staying low carb would be very, very important for you. So fasting will still stimulate the healthy insulin IGF-1 factor that is for good healing and help to preserve your skin thickness. But you might want to rub on some of that oil from peskin, which is the essential fat that's in your cell membrane. Jana is the next question. She says, what is the best way to bolster white blood cell count and general health and immunity after going through cancer treatment, chemo for breast cancer? DHEA, dihydroepiandrosterone, is very well established. I give it all the time. It doesn't have any negative effect on anyone with cancer, so I give it to all my cancer patients. I take it myself anyway, but I use DHEA, dihydroepiandrosterone. And what this does, it is helps promote the total number of white blood cells. If you eat a healthy protein fat diet, and fasting stimulates your immune system, your white blood cells, it stimulates your bone marrow and the T cells that are associated with your immune system. Fasting is probably one of the most anti-aging things you can do. He who eats the least lives the longest, essentially is a good motto to believe in. So I would use DHEA. I would do intermittent fasting. That's skipping your breakfast at least, and maybe twice a month I'd try and do 2 days in a row of fasting. I would eat a rich protein fat diet, drink plenty of water, and I would exercise. Exercise also stimulates the immune system. Getting a good night's sleep will stimulate your immune system. So those are my suggestions there, Jana, for you as well. Let me go to the next question. Deanne says, can irritable bowel syndrome be healed naturally without taking 75 milligrams of Viberzi every other day? If so, explain how. I am not familiar with the trade name of Viberzi, Viberzi. I'm presuming that it is a immune suppressant. That's what I'm thinking. But yes, we deal with irritable bowel syndrome all the time. And we start by finding out what your blood type is. And then we ask you to do the immunofood allergy test, which gives you the slow reacting IgG food allergens that you definitely have, and we all have to some degree, but it is destructive to your health when the volume of foods you become sensitized to becomes too many. And we put the patient through a restricted eating program. If we don't have the results of your blood type or the immuno, we start by saying have a one menu day, meaning we would ask you, since you reconstruct the lining of your gut, which is one cell membrane thick, in other words, one bilipid layer thick, and that needs the phospholipids and the protein. So if you ate a grass-fed steak and you had broccoli with it with butter and salt, and you had that for lunch and for dinner, and you ate only between noon and 6 p.m., and then your stomach's empty for the rest of the time, 18 hours until the following day's lunch, then you would have a different menu, let's say roasted chicken, wild prairie raised, and green beans buttered up and cooked, and you'd have that for both lunch and your dinner, and then have an empty stomach for 18 hours. And the third day have maybe salmon and asparagus for lunch and dinner. And then the fourth day have pork chops with spinach, buttered up, salted for lunch and dinner. Then you can go back to your beef and broccoli day. That narrows down your whole immune stress that inflames from irritable bowel. That narrows down to 8 antigens or food components that could be causing the irritable bowel in the first place. There could have been a trigger. You could have had Montezuma's Revenge with a Giardia or something that, denuded the lining patches of your gut, or you could have had a viral influenza and you had the diarrhea with it. And then natural things that are good for you and you ate that would leak through, and then you develop antibodies to healthy foods. So if you narrow it down to 4 different proteins, 4 different vegetables, and you pair them up, then you're only seeing 8 different food items in the span of 4 days, instead of all these chemicals and components that are in breakfasts and lunches and dinners. It's an absolute atomic bomb of information that your gut immune system has to deal with. So by disinflaming with a very simple 1 menu day plan that you rotate for at least 4 days before your body sees that food again, that's the beginning of healing for irritable bowel syndrome. And we could add to that, the SBI Protect, the Ortho IG probiotics. We could add to that NT powder, which is the powdered form of the phospholipids that are in my bar and in the meats and things like that. We could add in digestive enzymes. You probably would need help with that. But that's how we would begin, and hopefully that is giving you some idea, Deanne, with how we would approach that. Deanne also goes on to ask, should a person who is beginning to take TLC metabolic formula for type 2 diabetes also take Juice Plus? Yes. If so, just vegetable or also fruit or berry? I use all 3. Remember, the fructose content is really immeasurable in the capsule form of the Juice Plus. If they take the capsule of the orchard, capsule of the vineyard, and capsule of the garden, so vegetable, fruit, and berry, and the TLC metabolic formula, that's an excellent, excellent way to address type 2 diabetes. Do intermittent fasting with exercise, drink plenty of water, and that is a big help to the people with type 2 diabetes. And use all 3. Linda then asks the question, hello, Dr. Rita. Hi, back to you, Linda. My 91-year-old dad has just been diagnosed with Parkinson's disease. He has been struggling to walk for the last year and has tremors in his hands. Can TLC help him? Well, yes, definitely we can. There is a YouTube up on YouTube by Dr. David Perlmutter, Perlmutter, Dr. David Perlmutter. And maybe it's Pullmetter. Anyway, if you put neurologist David Perlmutter and then you put Parkinson's next to it, you'll see a YouTube on YouTube of him giving an infusion intravenously of glutathione. And this glutathione literally loosens up the connections in the central stem for motion, conversation, tremors. And you'll see a very elderly man who stutters with his conversation. He walks with a very shuffled feet, and he can't turn unless he shuffles about 12 different steps to turn around and then shuffles back. 30 minutes after glutathione, powerful antioxidant, he's able to walk and then turn around and then speak normally. So we have that. We have the glutathione infusions. He needs EDTA chelation. He's probably heavy metal toxic. And he needs the repair of the brain and nervous. Remember, the myelin sheath of the nerves is a fatty lining, and that's full of those fats we're talking about, phospholipids. So, and at his age, he would need digestive enzymes to help him break those things down. Same diet, healthy, limited, uninflaming diet, digestive enzymes, glutathione, chelation, glutathione oral and intravenously, and we could definitely give it a good try to see him get some more years and joy in his life. Let's see, what is the next question? I lost my space. There we go. Christina. Yeah. Christina. Hi, Christina. Are there any side effects from taking estradiol? I noticed 2 dosages on the store site for the roll-on. Which is best for a 40-year-old? Thank you, Dr. E. Appreciate you. And I appreciate all my wonderful patients. You have to have a reverence for the majesty of humanity, a human being. It is just such a magnificent creation of my God, all the people I see. But anyway, back to hormones. If you're 40, and you still have your ovaries and your uterus, then it's a difficult time for a doctor to understand. As we make you healthier, maybe your ovaries will work a little bit better. So we don't want to make your estrogen too high unnecessarily, and we certainly don't want it too low. I don't know of any bad side effect. When you're a young girl, for instance, let's say you're 10 and a half, 11 years old, you're starting to slowly produce estradiol over months and months and months and months. And then finally, you get enough mass and maturity, and a ovum will ovulate, your first ovulation, and the bag it was in will produce all this progesterone, which will clean out that uterus that had been under the influence of estrogen for maybe even a year before you had your first menstrual cycle as a young little girl. When we are adults, and either we had surgical hysterectomy, or we get so stressed or ill and our hormones aren't being produced as much, then we get hot flashes, we don't sleep as well, we get irritable, and our joints begin to ache, and our memory starts to fade, and our bones start dissolving away. Then these are the bad and dangerous things for a woman. And we don't want those things to happen. So when we give you estradiol, and let's say you haven't had good doses for a while, and certainly no ovulation to help balance it, you're going to feel the presence of its action on your breasts. You might get some breast tenderness. And we tell ladies that if you get breast tenderness, it will go away. It will over time. And that's why we tell you to drink plenty of water and to take systemic enzymes, because when you're young girls, we're all full of these enzymes. Our bruises heal up real quick. We don't have any joint pain. So giving replacement estradiol is really an individual thing, and you have to agree to work with your doctor to take a few samples to make sure, as you're getting healthier, if you're doing all the other healthy things, you might start redoing and producing estrogen, at which point we might reduce the dose of the estradiol. So it's a very difficult thing for a doctor to handle perimenopausal and early menopausal women, because their ability to recover is fantastic. Now, we have the 4 milligram per ml Topi-Click, and it looks like this. And you twist the bottom, you take the top off, and it comes out the top hole here. Each click is 1/4 of a milliliter. So if you did 4 clicks, 1, 2, 3, 4, you're going to get a whole milliliter of cream on the top, or 4 milligrams. I usually start with 1 click, and that's 1/4 of a milliliter or 1 milligram. And we usually rub it here or on the face. I put mine on the face so I don't wrinkle so much. It helps with elastin and collagen. And then I test to see how did that affect you, because every person's unique. If it isn't enough, then we'll use more. Or if you place it to your vulva near your clitoris, the moistness there, it'll absorb very rapidly. But then that can shoot the estrogen up quickly, and then your breasts will be tender for a while. I never give estradiol without giving progesterone, because progesterone also is the balancer for the benefits of estradiol, but the progesterone is its control mechanism. So you have to always consider that too. So the other dose we have is 6 milligram. So each click is 1.25 milligrams of estradiol, and no, it's 1.5, yeah. So that, 4 clicks is 6 milligrams. And so, let's see, did I answer your question? 2 doses, which is best for a 40-year-old? So there isn't an answer. You need time with your doctor and testing to determine what's best for you. And that might change for you as you get healthier. And you might need less, you might need more. So work with your doctor on that, and hopefully that works out for you. And then Christina also asks, for a carnivore diet, do you recommend eating cheese too? I do, because it is an animal product if you can tolerate cheese. Now, the caveat there is I primarily eat raw cheese when I do eat. And that raw cheese is, I go to Sprouts and I get the organic pastures. And it comes like a brick of, and it's called cheddar cheese. And I just slice off what I want, or I grate it. So that's what I use. And yes, that would be fine as well. I don't think I would do it every day. Like, I don't think I would eat steak every day. I try to rotate chicken, steak, pork, and cheese. Let's see. Deborah asks, how can doctors' nutrition bars help cancer patients? Oh, in many, many ways, because the whole deal with cancer patients is they need to be very low carb. They need to be keeping their insulin very low. They need to keep their glucose very low. And they have, very often they're under chemotherapy with a lot of cell membrane damage, a lot of free radical damage here to the, injury to the membrane. And we want to get it repaired to this nice membrane. So the phospholipids in the doctor's nutrition bar is literally what this is made of. We got together as doctors here with Sierra Labs and others, and did a IRB review board, and doctors reviewing our work, and we tested it on humans, and that was tested with the CoQ10 as well. And we designed this into a bar because we were sick and tired of people being bamboozled and tricked into trying eating less fast food by running and getting a box of protein bars. But these protein bars have tremendous amounts of things in them, and they're full of sugar. We tested the most popular bar. If I said the name, you all would know what protein bar I'm talking about. So we picked the most popular one, and we compared it with our bar on fasting people. They hadn't eaten, and then they ate the bar, and it was randomized and controlled, blinded both to the doctors and the patients. So nobody knew which they were picking, and the doctors didn't either. And then after they ate the bars, they got their blood drawn. Then they ate the bar, and an hour later, we tested their blood again, so we could see the rise in the sugar and the rise in the insulin. And in both cases, ours hardly raised at all with the sugar and with the insulin. I think The glucose went up 22 times higher in the bars they were popularly buying, and the insulin went up over 5 times higher with the popular bars. So a patient needs to eat stuff that you're made of, okay? And you need the fat and protein. So we put it in the bar. So those cancer patients need that. It satiates you. We tested it for taste and texture, and for the feeling of satiation and mental focus. Because very often when you're under chemotherapy, not only are you feeling sick and nauseous because the lining of your gut has that same phospholipid. So by eating that bar, you're getting a low glucose, low insulin, phospholipid rich, protein rich. We have the highest protein, 15 grams per bar. We have the highest fiber, 15 grams per bar. And I think 2 or 3 net carbs. It is an excellent thing for all people. And that's why we made it. And it would be a great help, Deborah, for cancer patients, most assuredly. Let's see, Garden Fairy. Hi, Garden Fairy. Good to hear you're looking to hire more doctors. Yes, if you know of any that have been fired recently or are looking to do integrative medicine and love the Lord, then let me know, because we need to hire them right away. Okay. Good to hear you're looking for more doctors. My first appointment for hormone issues isn't until July. Well, then call the office, and I don't know if you're my patient or another doctor's patients, but if you type office at tlcdoctors.com, office at tlcdoctors.com, put that question out there and say, I said for you to contact, and that'll be picked up, and they'll find out if I'm your doctor or someone else, and we'll see if we can't fix that, because now that's way too late. You have to have more fine tuning. Kaya says, how can one lower their cholesterol without taking a statin? By avoiding starch and carbs and sugars and fruits and chips and too many nuts and seeds and crackers and bagels and cereals and potatoes and yams, because sugar and fruit sugar, when you eat more than your body needs for the moment, that is flooding your blood vessels, and your insulin will come out and grab them and sew them into little fats called triglycerides. So the very first fat made from too much starch and carbohydrates and fruit sugars and sugar is a fat called triglyceride. That's why if you're my patient, I hound everyone on their triglyceride level. I look at the blood sugar. I want it to be 85 or less. I look at their insulin fasting. I want it to be 3 or less. I look at their hemoglobin A1C. I want it to be 5.2 or less. And I look at their triglycerides, and I want it to be 50 or less. But the world's doctors will say triglycerides can be 150. Your insulin can be up to 25. Your hemoglobin A1C can be up to 5.7. And your fasting blood sugar can be as high and called still normal, up to many cases 124 I've seen, although more and more lately are saying 99. That's too much sugar, folks. That's just an average of sick people on their way to disease. If you want to know where health is, you have to get those down. So when you are clogging up your blood vessels with too much sticky sugar, you're creating micro cell damage and hypoxia. And that creates irritated cells. The membranes bust up and break up, like in this picture here, and fragments. See these fragments right here, these busted out little particles here? And when they're knocked out of their place, they send a message. They send a message to your liver, and the liver senses cell damage, and then it pours out cholesterol to find its place to plug those holes that are in the cell membrane. So the prima facie factor is a high carb diet. Always has been. We had a corrupted system that said in the 1970s it was cholesterol, high fat, and they were bought out by the industry. They lied. If you want to look at a article, a YouTube on that, go to Oiling of America, Oiling, Oiling of America by Sally Fallon, Fallon. That's an old one, but there's been many more since. But I really love how that one goes through the entire history. Another person is Tina Techholz. Anyway, she wrote a book. She also got published in the in the British Medical Journal. She got published, and Tina was a journalist, and she set out to figure out what is the cholesterol story, who's right. Are these people who are saying it's the eating cholesterol is from your diet versus those like me who say it's the high carb? And so she reviewed the science and the literature. She took 10 years. She published this, and her accuracy was so good. I wonder what her last name is. Tina Techholz. The Big Fat Lie. She wrote the book called The Big Fat Lie. She also has YouTube lectures. So if you look on YouTube, The Big Fat Lie, you'll see Tina Techholz, and she's fantastic, plus so many others that have endorsed it. So that's how you lower your cholesterol. Exercise, drink plenty of water, don't eat late at night, and so forth. Constance says, is there a natural Aleve, Motrin, etc., to help with a torn muscle sport injury that can address the pain? Absolutely. And they are enzymes, systemic enzymes like Vitalzyme. It's the most potent one I have. I don't take any meds. Well, I take my natural hormone, but I don't take any medicines, and I don't have joint pains. I worked out really hard Sunday, and so I was a little sore today, but I take Vitalzyme, and if you took 6 or 10 on an empty stomach and fasted for 24 hours, just sip on chicken broth, beef broth, and put a tablespoon of butter in your coffee. Technically, that's not fasting, but it's still great. And you take 6 to 10 Vitalzyme twice a day on an empty stomach, you'll immediately feel better, because that's how God naturally heals torn ligaments and muscles and injuries and infections, is by using enzymes to clean it all up. And drink a ton of water. Let's see. We also have Vascuzyme and Proteozyme, but the highest potency and probably the most clinically tested is Vitalzyme, systemic enzymes. Wendy says, what if your urine smells sweet for days? Well, you could go to the drugstore and you can do a dipstick, which is for ketones. They usually have these urine dipsticks, and you can see if there is, it has, diabetics often have this. You can buy them that'll have blood sugar testing, so you could test it. And you can go to your doctor. A sweet smell doesn't necessarily mean it is sweet. You could put a little bit on a plate, a tiny little plate, leave it on your lawn, and see if it attracts insects and bees. That's another way to see if there is sugar in there. And the best way to turn that around is with fasting and exercise. Wendy says, how can my friends detox from the COVID jab? Well, enzymes, it's the same thing. EDTA chelation, EDTA is an amino acid-like molecule that is negative. It's an anion. COVID, the spike protein that is produced from the jab is a cation or positive. So when you infuse chelation, not only does it help prevent microclots, but it also will help grab up these spike proteins and you pee them out. Enzymes will disinflame you because that produces inflammation. Drinking plenty of water, eating a rich protein fat diet, or taking phospholipids or the bar NT factor powder. These all help repair the injured cell membranes. Fasting stimulates growth hormone and repair. And taking quercetin, a lot of quercetin, because that helps to prevent spike from, being injured to the next cell. That's a natural antihistamine. So that's what we would do here. Joseph says, hi, I'm 70 and using Norco for 15 years. Is it okay to continue? Well, it depends on why and how much. Norco is a narcotic-based pain-relieving medicine, and there are people who are in chronic pain that require this. You can have problems developing dependencies, but in and of itself, I don't see a problem with use if it's under the supervision of your doctor for the reason why and how much you're taking. So again, Joseph, if you used enzymes and water and did some intermittent fasting, these are natural pain relieving things to do, just like the talk about the fibromyalgia earlier on. Garden Fairy, hi Garden Fairy. It sounds like perimenopause could be one cause of my pain I've had for years. What are the labs you would want to see for a 55-year-old menopausal lady before starting hormones? Well, I would want to know your blood type. That impacts everything because it's just like knowing you're a man versus a woman, your age, and risk factors. So blood type, I would want estradiol, progesterone, DHEA, testosterone. I would want your thyroid stimulating hormone, TSH. I would want your free T3 so I can understand your metabolism. I would want a general chemistry comprehensive panel that'll do your blood sugar and your protein and electrolytes and calcium and liver, kidney, and bone enzymes. I would want a CBC blood count, and I would want a hemoglobin A1C, an insulin, and I would like a lipid profile to address. Those are the things I would want, Garden Fairy. Joseph, yes, that's the lady, Nina Techholz, Teichholz. Thank you, Joseph. That's my TLC Health Freedom Tribe helping out. Thank you, Nina Techholz, I think that's an I. Yeah, Teichholz, Nina Techholz. Yeah, listen to her. All right, EH. Hi, doctor. What causes cramps when stretching? 99% of the time is lack of enough water every day. You can become chronically dehydrated. In fact, that's the way of life. So a newborn baby is born with a water composition of roughly 85%. Of that, if a baby's 10 pounds, let's say, that's a big baby, but let's just say for ease, 10 pounds, and 85% of that baby is water, you're going to say about 8.5 pounds is water. So as you become a child or a high schooler, that drops to 80%. And then as you become a young adult into your 40s, it becomes 75%. And when you get past around 55 to 60, it becomes 70% and lower. And these numbers might be worse because of marketing and kids having these damn phones and seeing all the marketing about drinks of latte, frate, energy drinks. So even kids might be getting sicker, more worse because of drinking even less water. But dehydration is the number one. And then the number two is magnesium deficiency. So I would work on your water. Whatever your pounds are, cut that in half. That's how many ounces you must drink every single day. And then get a good multi-mineral in we have TLC multi-min, and I use the Albion mineral chelates that are much better absorbed. Amila says, hi, Dr. E. Hi, Amila. Can a 12-year-old take Clinicians essential oil? Yes, they can. Or is it a supplement only for? No, children can take it too. It's very valuable. Now, if a 12-year-old child is only, 75 pounds, give her half a dose. Usually when a person is above 85 pounds, I treat them as an adult. So that's your guidance there. They'll develop a better brain. Boys' brains develop until they're 27. Girls fully mature and develop at 23, roughly speaking. And then O positive. Garden Fairy says her blood type is O positive. All right, so O's as a general class have more of the arthritis, joint ulcers, rheumatoid arthritis, osteoarthritis, and ulcers as a general rule. So, and they get the ulcers. All right, and Perry Lynn, why are you so bloody interesting? I could listen to you. All right, well, thank you. Well, it's because I don't know. Maybe doctors don't. They don't trust being, I'm a general practitioner, so I've been doing this 40 years, and I've had people coming at me day in, day out, 40 years, and I don't think there's anything that throws me at this point. All glory to God, we give him the praise. But I would just say, if you're going to be a doctor, you have to want to be a student all the days of your life. If you're going to be a doctor, you have to stand in awe of the human body. You have to reverence humanity and the great potential that they have. And you can't judge by religion or by race. You have to treat with that code that you're treating one of God's creations. And that's how you have to be if you're going to be a doctor. Constance says, is there a way to control the urge to urinate when we drink so much water? Do you have preference on water, mineral water, purified, distilled? I am for a purified water system of some sort. I don't care if it's an over-the-counter Berkey that just largely is getting out the basic core contaminants and lead. And then you can upgrade to a more sophisticated system. But filtering your water is important. Trying to get it such that potentially, if you can afford a system that gets the fluorine out, that's probably the best. I don't care if it's alkaline or not. If I had a preference, I would say mildly alkaline would be better. There's vortex water. There's water that's spinning. Water is an amazing molecule, and stagnant water has less penetrability in it. There's so much science on water and its behavior. It's rather awesome. So there's vortex water, there's filtered water, there's getting the fluoride out of your water, and there's alkaline versus acidic water. So I like drinking water above 7.5. I like vortex. I don't have a vortex, but maybe I'll get that next in my life. We'll see. Let's see. And the urge to urinate. You can train your bladder. As I've gotten older, almost 70 now, I can sneeze and have some leakage. And I realize, because I do drink half my weight, I have so much volume that I have to stop in the bathroom more often. It's no big deal to me. And I do Kegels and I do exercise and I take hormones, which helps the thickness of my short urethra and it helps the flesh tone. So I have more meat, so to say, to crunch down on. And that's about all you can do other than seeing a urologist and talk about surgery or stuff like that. Some women had such trouble with child delivery that they have been torn and scarred and they have an exceedingly poor problem. I do have a Mona Lisa touch. That's with laser light treatment, especially for women who have had breast cancer. If we insert intravaginally this light, that light actually stimulates healthy cells and the lining of the vagina so it doesn't hurt with intercourse if the woman is postmenopausal, breast cancer, can't be on hormones, and she's thinning and drying out. So light treatments also are very important. And all right, Constance, what about too many minerals from mineral water? I'm not sure I would trust a marketed mineral water. Rather, I would take water from the city, I would distill it, or I would put it through my purification system, and then I would drink it. Or maybe the next thing I'm going to do is put Vortex to it, and I would take a well-researched multi-mineral that's an Albion, so I know what I'm getting. And then occasionally see your doctor and get a red blood cell mineral assay, and you can get a real good idea. So it's after 7. So we've really gone late today, my TLC Health Freedom Tribe. We've really gone a long time. So please remember to like and subscribe and share this with family and friends and try and get, as many people as healthy as we can. That's how you build your immune system, not other aggressive modalities. And I want to say to you, God bless, God keep us all safe, and Merry Christmas. And I trust you all had a blessed Thanksgiving. Stay connected, be forgiving. I've been forgiven much. You forgive others too. Okay, well, God bless everyone. Good night.